Welcome to Swallow the Gap, the podcast that delves into the critical world of dysphagia practice and education. I'm your host, Dr. Tim Stockdale, and I'm thrilled that you've come to join us for the second season of conversations aiming to bridge gaps surrounding dysphagia intervention. Swallow the Gap podcast is a production of Gap Education, and we are predicated on a mission to improve dysphagia care. Nothing we say is legal advice. Nothing should be taken without scrutiny. While we strive for accuracy, we do not imply perfection. We value diversity in backgrounds and opinions, therefore our guests will not always reflect what we believe. In fact, we may change our minds as we learn more because this is how progress is made. Through critical reasoning with open minds, we serve as catalysts for advancement in medically focused speech-language pathology. Welcome everybody. Joining me today is Jaclyn Pederson. Jaclyn Pederson is the CEO of Feeding Matters, and Feeding Matters works to advance the field of pediatric feeding. So I know that I suppose most of the listeners here are for adult dysphagia. You need to stick around. There is a tremendous amount of cross-application in how we're trained for adult dysphagia with how Jaclyn, what she's uncovered as far as pediatric feeding training. And I suspect, maybe a number of us have gone into adult dysphagia by necessity because of some of the reasons that she's going to mention, that there is not a whole lot of training. I mean, we think there's a paucity of training for adult dysphagia. Look at pediatric dysphagia. So stick around. Jaclyn, what else would you like people to know about yourself before we continue?
Thanks, Tim, for having me. So my background is actually not clinical. I have a background of nonprofit leadership and management, and then my graduate work is in healthcare innovation and systems practice. So I always look at things from like a systems lens, and that I think really applies to the research we're going to be talking about today.
Well, it seems like that would give you a heads up in being able to affect change and not just being like you'd be a great collaborator for clinicians like all of us listening here to be able to like, hey, this is how you take some steps to get things done. Is that fair?
That's true. I mean, I think that hopefully I'm kind of and that collaborator to bring a different perspective and get this work done together. Because I do think that we can move mountains as long as we're doing it all together.
Okay, good deal. Good deal. So this article we're looking at preparedness of speech-language pathologists and occupational therapists to treat pediatric feeding disorder, a cross-sectional survey. This was published received December 5th, 2023, accepted May 10th, 2024. So this is recent. This is good stuff. What would you say are the main primary key takeaways from this?
The primary key takeaways from this article are that there really isn't a well-defined educational pathway that allows a professional to develop a specialty in pediatric feeding and swallowing. That is something that I think is assumed by a lot of families who are looking for providers to treat their children. And then I think if you're a student, and we see a lot of students interested in feeding and swallowing, and you end up not realizing that you kind of have to build this path along the way. And so I'd say that's the highlight is you think there's a pathway, but there really isn't.
And this sounds like it's not just unique to speech pathology. Is that right?
It is not just unique to speech pathology. So in the field of pediatric feeding disorder, so the definition of pediatric feeding disorder is when a child really isn't eating appropriate for their age, and they have dysfunction in the medical domain, the nutrition domain, the feeding skill domain, and the psychology domain. And so within that feeding skill domain, it's a lot of crossover and collaborative work between speech language pathologists and occupational therapists. And that collaborative work looks different based on what the background of that professional has and what is available within that community. But yeah, it's for both. And so that was a big highlight of this work too, was it wasn't just one discipline that needed a little bit more support. It was both.
Okay, very interesting. What was it that led to you investigating this?
A lot of it is because at Feeding Matters, we support families. And so when you're trying to help families find the care that they need, we had to continuously build supports around families to help them understand that you may be trying to go find intervention for your child who is having trouble with feeding, but that person may not have had the education that you think or expect them to have had. And so it started with supporting families, and then it grew to kind of like the advocacy and the awareness work of like, okay, well, if that's a problem, how can we be a part of the solution? And so we were like, okay, we need to at least build an evidence base to figure out what's happening. And so that's what led to us doing a survey of, okay, across the United States, how are people feeling about their educational efforts in this area? And so there's a precursor to this publication actually that just is a general like landscape publication from the survey, which is, who's treating what, how are they treating it, what does that look like, with 815 individuals. Wow. And then this got into the specifics around the feeding scale domain. And so the history of this is really like, if we need to change and prepare professionals to better support families, we need to even figure out where the baseline is. What are individuals coming out of school learning, or what was their pathway to developing a specialty in this area? And so a lot of it was just our own curiosity.
Yeah. I mean, it almost sounds like you're being strategic in trying to figure out how to fix this, which is
a lot of advocacy work is pretty strategic. Yeah. It's hard to, when you go into advocacy conversations, a lot of it is like, well, show me the data. Show me the data. And you're like, this is an emerging field. There really isn't a lot of research in this area.
Yeah. I mean, this is a pretty good start though. And you have a remarkable N. You have 418 speech pathologists, 195 occupational therapists for a total of 613 people that you surveyed. Kudos. Yes. That's awesome.
Thank you. Thank you. It was very helpful to have such an amazing community of support to be able to fill out this survey. We did also get funding for this research. So we were able to offer an incentive, which I also think is like really helpful in research and being able to up your participation numbers. And then I think it helps that Feeding Matters is really popular among pediatric feeding professionals. And so we were able to leverage our community to be able to fill out the survey. But that is described as a limitation too, because, that was one of the primary recruitment methods. So there could be inherent bias in that sense.
Yeah, for sure. No, I was thinking the same thing. I was like, I got to reach out to my audience, I say my audience. That's, and I almost said something like, I did say something like that earlier, and I corrected myself. It's a community. It's a platform where people talk. I don't know. I don't like referring it to my audience, because I would say I'm one of the least important parts of this show, that it's the people who come on, and finding them. And of course that stuff matters, and engaging in conversation. But looking at people who come from all these different perspectives, bringing them together, having a conversation, giving them a platform to be able to talk about things that are important to them, and raising awareness of clinicians about what's important. And, I'm a small part of that. So forgive the semantics of me saying that. I don't think it's an ego thing or anything like that, but
no.
So, this is really interesting. And what is making me think about, there's some work for adult dysphagia done in 2013 or 2014, Giselle Carnaby and Herrenberg. That came out and it looked at practice patterns of speech pathologists and saw that it's kind of like everywhere. And then Vos et al. In 2018 did something similar. I mean, there was, of course, more to the publication, but part of it was looking at practice patterns. And it was just so broad, not, so much standardization on, okay, if you see this, you do this or whatever. Not that everything's formulaic. Hardly anything is. But at the same time, it was a little bit alarming. Like, if there is really strong evidence behind X to treat Y, then why are we doing it all so differently? I don't know. It raised a lot of good questions. So when I saw this article, I was like, this would be something great to talk about. Like, this one in particular just caught my attention. Gap education is predicated on gaps in education. Imagine that. And
that's what I've heard. So, because my interest is in, okay, how can we make sure there is an educational specialty pathway? And so I've started asking questions of people, like, how do we get to this? Like, how do we work in partnership with these national associations to develop this out? Is it more at the academic institution and university level? Is it more at the national association level? Is it more at the employer level? We've even asked that of the community at Feeding Matters. And what does that look like? And I think it goes back to what you're saying of part of the problem is there isn't necessarily like a best practice for treatment. So how can you even train on that? And it just ends up being this cycle of we don't have enough research to show X supports Y. And so then it ends up being this black hole of people having to do the research on their own, find a mentor on their own, and really try to do this work on their own. And I think that's also where adult dysphagia comes into play, because the dysphagia world in general and research in dysphagia world it's come a long way. And I know it still feels like an emerging field sometimes, but I think the pediatrics of it is looking to the adult dysphagia world and seeing how that can be our leaders.
Oh man, that's a little scary.
I know.
No, I don't mean that to
blind leading the blind in some instances.
In some instances, and that's not something that speaks to the integrity of clinicians or anything.
No,
like that.
not at all.
It's a systemic thing that limits our training so much. And people, I'm not going to rant on this all episode. I promise, guys. But it's like 9 diagnostic categories, 5 or 6 semesters, and just so much variability in background. And I don't know. It's alarming to me. And like you had mentioned earlier, this is at least what I took away from your comment, that you started really supporting families. But then to support families, you're like, well, families are relying on clinicians. And clinicians are like, oh, well, I don't know, that sort of thing, because of the lack of training. I mean, think, if you're, whoever's listening right now, think of your training in adult dysphagia, right? So think of that. Think of what it should have been or what it could have been versus what it was. And now think about your training in pediatric feeding or pediatric dysphagia, those types of things. I mean, even like pediatric motor speech, limited, depending on where you are, for sure.
Yep.
Okay.
And your exposure of it and what the passion of it's really predicated on what university or academic institution am I attending and what passion or history is at that institution. And that is what sets you on the trajectory for your career. And I don't think that this is in pediatric feeding disorder, it's a new condition. It was only published in October of 2021. And so in that sense, it is still very emerging. But this issue is one that I think could be done or a study done for many different other issues. I think the challenge is it's a lot of practice areas. And so it's hard to be a generalist and a specialist all at once.
Absolutely. Especially without, we have fellowship, sort of clinical fellowship for speech pathologists, but that's not like a medical fellowship or not like a residency. So I don't know. There could be a lot of things in place, but you think of well, who's going to pay for it? There's that component of it too.
That's a huge component too.
Yeah, and if we transition to a doctorate, it's also who's going to pay for it, because it's not like reimbursement rates are going to go sky high. We're going to be in more debt from going to school. We're going to be better prepared, but we're also going to be eating ramen noodles for the next 20 years,
Yeah.
So.
Well, and that's the interesting thing that's in this article is, both national associations, AOTA and ASHA, had pathways to do some sort of board certification or specialty in feeding and swallowing. And because it's within the scope, that pathway kind of existed, but people weren't using that pathway because the incentive to use it wasn't there. Yeah. Having the board certification didn't necessarily mean you were paid a higher salary or anything like that. So kind of back to that system problem. Who is going to pay for it? And I think that's the hardest challenge in a lot of these system problems is I was talking to someone the other day. They were like, who's to blame for this issue? And I was like, the system is always the person I blame, because it's just it's not built. And so then you see all the domino effects that result because of it. And families are left in the lurch, and then professionals are there too. You all as professionals are just trying to support your families and do the best that you can clinically, but it's challenging for you too.
Oh yeah. There's a lot. I kind of a one-trick pony, because I want to be good at dysphagia.
I'm sure you feel that way.
Well, there's a lot of other stuff. I find that when you go into dysphagia, you get motor speech disorders, you get all these acquired neurogenic disorders and whatnot. So I love all that too, but I am lost as far as pediatric feeding goes. I'm lost as far as phonology and a number of other things too. But this is so far out of my comfort zone. It's crazy. It is just so far. Back to the article. So we've kind of got an idea And would you say the theme is that, training is limited, it's not standardized, it's not supporting clinicians? Is that fair?
That is very fair. Yes.
So, what are some of the most alarming takeaways for you?
I think the most is that treating pediatric feeding disorder is in both scopes of practice for both disciplines, yet the standardization for how a clinician may be coming out of school is not there. Overwhelmingly, the respondents shared that they felt underprepared to be able to treat this coming out. And again, who to blame? The system is to blame. There's not great mentors available for these students because there's not a lot of research out there. And so it's this, it kind of piles on. But, what we detailed in what we heard from the survey and the respondents sharing their kind of their self-directed educational pathway was really dependent on if they were able to find a fellowship that made sense in the feeding world, if they were able to find a mentor. There was a lot of like taking courses and different classes, and that kind of produces its own challenge as it relates to where evidence is at right now. And then I think a lot of times people are also doing things like listening to podcasts to get exposure to other things it's mentioned in, and having article review clubs and kind of some of those like more case, like peer-reviewed sort of self-directed activities.
Yeah, it's very interesting. I'm thinking about this, and I'm thinking if someone was going to have like open heart surgery and they're like, oh, where'd you go to medical school? Oh, I went to Harvard Medical School, or like, whatever. Or where did you learn to do cardiac surgery? Well, I took some CEUs. I got my general medical degree, and then I took some CEUs. I even did a little bit of hands-on practice under a mentor who was also self-taught, and it was alarming. You'd be like,
oh my gosh, Jim, that's such an interesting metaphor.
You'd be like, get away! Like, I'm going to go to some other place, some other country, other side of the world where they actually like teach this based upon an evidence base. And so, like, I think the thing with that though is we know like, oh yeah, you need the heart to live, right? Someone gets in there, they can kill you really fast if they nick the aortic artery and you bleed out, that type of thing. And that's a big deal because it's like, it's in your face, like, oh yeah, heart surgery. That's a big deal. And so I think with this, it's important for people to understand what are the implications of not doing this right.
Yeah, the gravity of it.
Yeah.
Because you're right. It is not as in your face as a cardiac issue. It is subtle. And I think we're starting to see the impact of it right now. So the pediatric feeding disorder, if it's not identified or not treated well, or even in some cases, if it is, it can turn into ARFID, avoidant restrictive food intake disorder, which is a mental health diagnosis later on in life as an older child and into adolescence and into adulthood. And so I think that's one of the impacts is the true psychosocial damage of not getting identified early, but also not getting to a provider that can support your feeding skill development, including your swallowing, as well as your psychosocial relationship with meal times. We're finding, because the research is now progressing a little bit, we're finding that it takes us 7 years and longer to learn to eat, to refine those skills. And if there's any disruption in that, it can have devastating effects for the individual, but then for the entire family, because this condition brings families to their knees because it is just so stressful, so expensive. And then to be told, I don't know if you're seeing the right provider, like you've got to evaluate whether you have the right provider or you're doing further damage, is really challenging. And the problem is that even if a provider thinks that they are qualified or thinks it's within their scope, I sometimes worry that they don't even necessarily have the foundation to know that. And so it's just a real big crisis. Well, because this is a very prevalent issue.
And the whole thing with self-assessment, like you're saying, like someone feels like they're pretty good at something. Like when I was in the third grade, I thought I was pretty good at basketball. Like I thought I was pretty good. And I would,
Going to the NBA.
Exactly. And I would get so ticked off if my mom was like, what happens if you don't go to the NBA? I'm like, Mom, come on, don't be a hater. Like I thought I knew this. And obviously I'm third grade, very cognitively underdeveloped and whatnot. But this is hyperbole, right? Using hyperbole. But then you go to like a bigger town where a lot of other kids play and you get schooled and you're like, oh, okay. This is what it looks like when you're doing, the right thing or whatever. And then they go to another place. You get to a bigger pond, and you see, oh, I'm not as good or as smart or as whatever as I thought I was. And so there are limitations in self-assessment if you don't have a way to calibrate. And I'm going to take that back and say, well, I'm not going to take it back, but I know there are standards that are out there to look through this checklist. But how many providers can say that when they started practicing, they met all those standards? Like, I would be baffled. I think that would be some really interesting self-assessment to calibrate with.
I would agree with you.
There are also known biases too. I'm not going to say the science is perfect, but like Dunning and Kruger's work, when you know a little bit about something, sometimes you think you know a lot more than you do. And then as you learn more, you're like, oh man, I didn't really know what I was talking about. I didn't know what I was doing. And then as you continue, your competence and your confidence become more proportional. But initially, like it's real easy for confidence to be through the roof. We don't know as much, just like little third grade NBA Timmy with his bowl cut out on the playground. Man, yeah, that's how it goes.
Well, and I completely agree with that. And I can't remember if it's in this article or the one prior, or maybe it's in a future one, but we were trying to get a sense of like, okay, because I think one of the questions asked was, what is your confidence level in treating pediatric feeding? And we saw a surprisingly high confidence level despite so many challenges kind of scored positively. So the lack of educational pathway, the having to do self-directed work and stuff. And I think it speaks to that piece of it's hard to do some self-assessment work in this area. And so the confidence is really high. I do hope that we can get a little bit more depth to some of those standards and work on what do we really want to see from a competence standpoint. So that way everybody can kind of be on the same playing field, because it's so individualized depending on what course you went to or whatever. Yeah. But all the confidence does seem to be high, which I think is kind of concerning from a sending families out into the world standpoint. And there are amazing providers out there, and I don't want anything that I say to detract from that. I am just trying to sound the alarm that we need to better support our professionals so that they can feel supported and feel confident in going out into the world to treat children. Yeah, and that's really been a huge razor's edge of this podcast and some other stuff that I try to put out, is that it's not meant to be critical of the clinician. Because if you're listening to this, and not say, like you might be listening to something else, wherever, if you're actively trying to learn, that says, so much about you in a positive way. But I think we are identifying that there is a problem there, and we're trying to find out what the cause of that problem is so that we can help to be a part of the solution. And like you were talking about the magnitude of this, the psychosocial implications. I mean, just from an adult dysphagia perspective, looking at the functional outcomes like nutrition, hydration, pulmonary sequelae, and quality of life. So the psychosocial stuff really hits on quality of life. If it turns into potentially a mental health diagnosis, that's pretty huge. And look at the role, though, of nutrition in fighting illness. I mean, I know more about that in the elderly than I do in kids, but you have, that's your immune system's developing. You have so much going on. And so that if you're undernourished and you're not getting the macronutrients and maybe probably even the micronutrients that you need to fight infection or fight illness, that can lead to early death. And in other places, like we're thinking the United States, we're very privileged, or Canada, the number of different places in the world. I don't want to assume anything about anybody who's listening to this, but I can imagine in other places where there is less privilege and less robust medical care, how this can lead to so many more
deaths and how it can just set people back so far. I am very fortunate to have a friend in Cameroon, and there's like this ongoing civil war there. And he's a remarkable individual. He takes people into his house who have been displaced, and he has kids of his own. And you see like all of this stuff that he's going through just in a different world than we're living in.
Yeah.
And so I don't know, like it's enough of a problem here that when we're not considering what people in other places of less privilege are going through, it's remarkable to me. It really is.
Yeah, that's very true. And this particular article was based on the United States respondents. But when we did do the survey, we did get some international respondents. We haven't gone back and looked at that. But I just know in Feeding Matters work, as we try to like talk to other countries and what's happening there, it is definitely a worldwide problem that no one has great solutions for, not only on the identifying the kids side and figuring out their treatment pathway, but also on the education side and getting more specialists available to treat children with PFD.
Yeah. So kind of along the lines of what you were saying, that most individuals who answered this were from the United States. What other limitations do you see in the potential to generalize this article?
Yeah, I think I mentioned earlier too that one of the challenges is we recruited through Feeding Matters and then the different listservs through the national associations. So, in that sense, I feel like we tried to get as many individuals as possible to participate, but I think there's always a limitation in bias in participation based on your recruitment methods. And so I think that's one of the biggest limitations. And just, it's important to kind of get a better understanding of what exists within the National Association standards, but then what also exists in the university standards. So as much as we are reporting on what people shared with us, and then we tried to also then research kind of what's happening in the field to try to share both of those stories, that may be a limitation too. Okay.
So as we get close to the end of this episode, there are two things that I want to make sure to cover. One, I want to see if there's anything else that you believe we haven't covered that is important for people to know. And other than that, I want to know, like, what do you think are some actionable steps that we can take to make this better? And maybe we're not there yet. Maybe we don't know. Maybe we as a profession don't know. Are there any other things that you think this article has brought to the light that are super out there important that we haven't discussed?
I think it's the start of the work. So I think for us, it was about, this is an emerging field of research. We know that like professionals aren't supported well. Let's get a better understanding of it. But for me, it felt very much the start of the work, and we need to continue the work. But I think, I guess maybe it's kind of a future direction or limitation of future direction in terms of what do we do with it. But you kind of get into this cycle of, okay, we know there's no educational specialty pathway. How do we fix it? We talk to the national associations, try to work in collaboration with them. They are open to partnership, but they often don't know what to do on their end because it's difficult from their perspective. And then we've talked to universities, and it's difficult from their perspective because they don't have standards of best practices to be able to then train individuals. And so to not use like meme culture, but it feels almost like the Spider-Man meme where everybody's pointing at everybody else. Yeah. And it's hard because it's like, this work needs to happen. And so, we have a vested interest in making it happen. We're a nonprofit. It's part of our mission. So we need to support families. We need to support professionals. But that's the future direction, is like, we're going to have to figure out this together and collaborate and really get curious about how we do that.
Yeah. And, from an educator perspective, it is extremely difficult. Like, if you look at all the things you're supposed to be teaching versus like what people are walking away with, if you cover so much breadth, especially like if these are students in their first, second, third semester who don't have a bunch of clinical experience to anchor this on, like sometimes you're at risk for teaching to the test, and long-term retention isn't necessarily there.
No.
I mean, teaching methodology has changed. The knowledge of how learning science, how we learn and can apply things has changed so much. And so I believe, and I think everybody knows that I believe this, that our scope is, well, speech, I speak to speech pathology in particular. Our scope is just so broad. And if it's going to be that broad on things, I mean, everything matters, but especially on areas where you can kill people or cause I can think just about any category can cause like permanent psychological harm, which is huge. There's got to be a clearer supported pathway for that depth. It can't be all student-led learning, right? And kudos, I commend everybody who is trying so hard to do their best, but we need so much more support. That is my belief. And I know that educators can't do it alone. I don't know the answer. No. I mean, hopefully someone out there, maybe you haven't figured it out. If you do, please send me an email. Come on the podcast. I would love to hear that. There's just, for sure. There's so much. So with what we have, what would be some actionable steps that listeners can take, or that, as a whole, as healthcare providers, that we can take?
As healthcare providers, I think there's two facets to this. So if you're interested in this as a field, definitely, if it's not anything that you have education in, you will have to go and try to find that education, unfortunately. The good news is I think you've got a plethora of different options out there for courses to take, or different people or mentors to follow, whether they're personal mentors in your local area or more kind of internet personality mentors. There's also many different communities of practice. There is a growing presence of pediatric feeding specialists in the SIG-13 group at ASHA and a community of practice at AOTA. So even if you're a dysphagia provider, like that may be an easy area to kind of find some others that are part of you. And then Feeding Matters is a community that supports families and supports professionals and can help you find other providers out there, find access to information, and more.
Well, thank you. Thank you for your investment in this as not being a clinician. I think it takes a village, and it takes a village with different skill sets and different perspectives. So I am very grateful for the work that you're doing, and I'm grateful for the work that so many others are doing as well. Thanks for coming on here. The name of the article, again, is Preparedness of Speech-Language Pathologists and Occupational Therapists to Treat Pediatric Feeding Disorder, a cross-sectional survey. This is in dysphagia. I can post a link to it in the website, the podcast description, and it's with Kelsey Thompson et al. There are 8 authors on this, so some pretty tremendous collaboration, it sounds like.
Thank you for having me.
Thanks so much. It was a pleasure. I learned a lot, and to be honest, I had a blast. This was great. So thank you.
Yeah, it was so fun. Thank you, Tim. Really appreciate it.
Thanks for tuning in to another episode of Swallow the Gap. Love to hear from you, so please reach out anytime. When you have a moment, share this episode with a friend or tell a colleague about us. I hope this episode has been beneficial to your practice and has sparked your curiosity.